Hello, my name is Aaron Crump. Um, the title of this presentation is The Importance of Water in the Body. So, when I used to work as a waiter, one of the first things I would ask as guests sat down is if they preferred to have water, and if they did, would they like sparkling or still? So, this New Yorker cartoon kind of reminds me of my days of offering water to customers and trying to upsell to sparkling to uh, increase their check. Anyway, so there are several functions of water in our bodies. Um, One of the biggest functions of water is to transport things in blood. So, about 80% of blood is water, and the water in the blood helps transport oxygen, carbon dioxide, nutrients, hormones around the body. So, the second function of water is that it helps our body regulate temperature through either expanding, dilating, or constricting blood vessels. So, when the blood vessels are dilated, it helps us cool down. When the blood vessels are constricted, our body tends to conserve heat. And of course, we can also sweat out water, so that helps us regulate temperature as well. Another function of water is that water helps maintain healthy blood pressure. And it does this through the kidneys, we urinate out fluid, and also through our cardiovascular system, which I explained a little bit earlier, that our blood vessels can change in diameter, which influences our blood pressure. And water is also really important for cell biology. Cells are made up of water, and without that water, our cells would not be able to function. Um, so, and lastly, I'll just say that um, sometimes I notice when I'm tired or I'm irritable or especially not thinking well that I know that I might be dehydrated and I might need to rehydrate myself and drink some water. All right, the next slide. So we need to know how much fluid we should be taking in every day. So according to the U.S. National Academy of Medicine, an adequate amount of fluid to consume every day is somewhere between 2.5 and 4 liters of water. Or if you put that in cups, it's 15.5 cups of fluid for men and 11.5 cups of fluid for women. The difference there is just related to body size. And of course, there's lots of variability depending on one's activity, the temperature that one is exposed to, whether one's pregnant or breastfeeding, etc. There are just innumerable different factors, but this is kind of uh, a good number to keep in mind. So, from that number, it's important to remember that about 20% of our fluid comes from food, and the rest is, water or other things that we might drink. Um, so, what are some tips that we could use to really drink enough fluid? Well, one tip I have is to drink a glass of fluid during every meal, and also to note that if you feel thirsty or if you have a dry mouth, drink fluids. And pee should be the color of this slide, which is kind of a pale yellow. So, what are some foods that we could eat? Well, obviously, lots of fruits and vegetables contain water. Uh, Watermelon and spinach are basically 100% water by weight. Uh, and as far as fluids, we could drink things other than just plain water. We could drink tea and coffee. Um, some things I like to do is I like to carbonate the water and add a splash of juice or something else just to give it some flavor. Some things I try to avoid as far as drinking fluids, sugary drinks, mainly because they contain a lot of calories and the sugar is not very good for our blood vessels. Energy drinks, alcohol, uh, excessive caffeine. Um, so how do we know if we are having enough water in our body? Well, I told you that we want to pay attention if we're thirsty or if we have a dry mouth. But some symptoms of dehydration are headaches, fatigue, dizziness, dry mouth, dark colored urine. So if you have any of these are symptoms of dehydration. And of course, it can become severe. So if the body does not get enough water, you can even faint. It can certainly affect one's thinking to where you're confused. Um, Especially if one is also outside, you can have heat stroke, etc. It can affect basically every organ in the body because water is essential for the good functioning of all of those organs. So the kidneys, the brain, the heart, all of those could dysfunction with severe dehydration. Lastly, and I think I mentioned this earlier, but we want to avoid beverages high in caffeine, sugar, alcohol, and salt because beverages high in those things interfere with our fluid balance. And they can lead to dehydration. So beverages high in salt can cause there to be fluid retention. It can also change how our bodies um, uh, deal with peeing and pooping. So if there's uh, lots of sugary drinks or lots of salty drinks, our bodies will try to deal with that by changing urine output and even changing gastrointestinal functioning. I know that if I drink a lot of caffeine, I will probably go poop. So on that lovely note, just remember that pee should look like this slide color. Thank you.